We'll now do a practice drill for the manicure and polish service, 19 tasks, 30 minutes. This is for the Maryland State Board Nail Technology exam. Some tips for this section is to break your file when you finish it. Before you come to the exam, you have your hand with 5 tips on it, no more than 1/4 inch long. At the end of the service, when you do the polish, you will use a dark red, and polish 3 fingers. Manicure and polish service, 19 tasks, 30 minutes. You'll be observed and scored on safety, sanitation, infection control, cuticle pushing, filing, massage, application of the polish, blood spill procedures if necessary. You're not allowed to use nippers for this procedure. Don't even bring your nippers with you. Keep them at home. You're not allowed to have them there. And also wipe your table and your stool down before you start and after you finish. Bring a water bottle with you also, just in case they don't have a sink. You have to assume they don't. So you'll now prepare and demonstrate a basic manicure on one mannequin hand. All 5 fingers, including massage on finger and hands. Apply a dark polish after you've completed the manicure. Here are some tips for taking the Maryland State Board Nail Technology exam. You can use these tips for all the sections of the exam. Always wear your goggles when you're using any type of the chemicals. So for the acrylics, the tips, and the wraps, you should always have goggles on. Keep your kit closed at all times. It's an automatic failure if your kit is open. Sanitize your hand before going into your kit. Label all the bags and items. Keep all bags and items closed. The monomer must be odorless, and it must be a new bottle for the test. Use tweezers to take things out of the bags or to take out a disinfectant. Throw all files away. New files must be used for each section, and keep your new files in your bag of supplies and materials for each section, and throw them out after each section. Keep your area and your table clean and neat at all times. Make sure you disinfect your table and sanitize your hands before and after each section. Safety and sanitation is always the most important. All implements must be disinfected at all times. If you're not using it, do not leave them on the station. Wipe down before putting back in the disinfectant. Sanitize your hands and your client's hands before you start. Sanitize and disinfect the table before and after each section. Thank you.